You have 42 days, just 6 weeks, to unlock the motion in your new knee replacement. Not 6 months, not once the pain is better, 6 weeks. After that window closes, every degree of motion becomes harder and harder to gain. If you're watching this in the first few weeks after surgery, you're in the critical window right now. And I'm going to show you exactly how to maximize every degree of motion while you still can. Hi, I'm Dr. George Bounajem, Dr. B for short, and I'm a Harvard-trained and board-certified orthopedic surgeon who specializes in hip and knee replacements. The difference between patients who get excellent range of motion and those who struggle with permanent stiffness often comes down to what happens in those first few weeks. In this video, we'll go over everything you need to know about the timeline, how to track your progress, and the specific strategies that actually get your knee moving again. So, why are the first 6 weeks so critical? Here's the reality. Studies show that knee motion can improve rapidly within the first 6 weeks after surgery, but often plateaus between 6 weeks and 3 months. The vast majority of your progress happens in that 6-week window because the scar tissue has not fully formed yet. Some people can make progress between 6 weeks and 3 months, but usually only a small amount. After 3 months, you're likely at your final range of motion because the scar tissue has fully formed, and very few patients see significant progress beyond that point. The bottom line is, the first 6 weeks is the best chance you get. This isn't about scaring you, it's about arming you with the information you need to make your time count. Swelling is coming down, scar tissue hasn't fully formed yet, and your body is in active healing mode. That's your window. Use it. So you know why timing is important, but where should your motion be at each of those 6 weeks? Let me give you the specific targets so you know if you're on track. Now, remember that everyone is a little different. Depending on the state of your knee before surgery, you may have more limitations than what I describe here. This is why it's crucial to discuss expectations with your surgeon before surgery. But for most people, the following guidelines are good goals to keep in mind, and they aren't random. People who fall too far behind are at higher risk of needing additional procedures or even surgeries to increase their knee's range of motion, so it's crucial to stay on track. By the end of week 1, try to get at least 90 degrees of flexion. For extension, aim for reaching within 5 to 10 degrees of full extension. If you get even closer to fully straight, that's even better. For weeks 2 to 3, aim for about 100 degrees of knee flexion. Extension should ideally be under 5 degrees by now. In weeks 4 to 6, the flexion goal is between 110 to 120 degrees. Most patients get to about 115 degrees, but bonus points for getting even more. Ideally, you'll be much farther along than 90 degrees by now. But you want to get to at least 90 degrees by this time frame so that you can do things like get up from a chair or climb stairs. Aim for 0 degrees, or fully straight, with extension. For weeks 6 to 12, aim to maintain your motion of 0 to 120 degrees or more. Don't go too easy on your therapy if you are an early achiever. Your motion can actually go down in this time frame if you don't work to keep it. Now that you know what progress should look like, how can you measure your own progress at home? This is actually surprisingly easy to do. You can use a smartphone inclinometer or goniometer app and take your own measurements. Studies show that these are pretty accurate, and usually within a few degrees of professional measurement. You can also just purchase a cheap goniometer online. For flexion, sit on a firm surface and bend your knee as much as you can reasonably tolerate. Place the goniometer at the side of your knee. Align one arm with your thigh and one with your lower leg, and read the angle. For extension, lie flat and try to straighten your knee completely. Again, place the goniometer at the side of your knee, aligning the arms with your thigh and lower leg, and read the angle. 0 degrees means flat. If you don't have a goniometer, you can also make a rough measurement by tracking how many fingers you can pass under your knee as time goes on. Track this about every other day at a consistent time, like after doing your physical therapy. A little bit of fluctuation day to day is normal, but consistent measurements let you spot trends very effectively. If you're falling behind the milestones, you'll know it's time to step up your efforts or talk to your surgeon. All right, you've got your roadmap and how you can measure progress. Let's finally talk about the most important part, how you actually get there. These 5 specific strategies, done consistently in those first 6 weeks, make the biggest difference in unlocking your maximum motion. First, control pain aggressively. You can't do the exercises that build motion if you're in too much pain to move. Better pain control leads to better motion outcomes. The reason is simple. Pain creates muscle tightness, and muscle tightness limits motion. You need to break that cycle. In general, it's helpful to take the prescribed pain medication 30 to 60 minutes before the physical therapy sessions. That way, it kicks in right when you need to push your motion. Talk to your surgeon first to see if this approach will work for you, but timing your medication around your exercises can make a real difference. Ice and heat are also very effective, but many people don't know how to use them properly. Ice reduces swelling, inflammation, and pain, all of which work against your range of motion. You can use frozen gel packs or a continuous cold therapy device that circulates cold water through a pad that you put on top of your knee. Whichever you choose, ice frequently throughout the day, 15 to 20 minutes at a time. Be sure to take 30 to 60-minute breaks between sessions so that you don't develop frostbite. It's also best to use padding, like a towel or pillowcase between the ice and your skin for extra protection. Heat helps too, but timing makes all the difference. Ice is your best friend for the first few weeks when the inflammation is high. But once you're past the initial phase, somewhere between weeks 2 to 4, heat before exercise can loosen up the knee and make stretching more effective. A mild heating pad 10 minutes before therapy can make a real difference. One common and very effective strategy is to use heat before exercise to loosen up, then ice after exercise to calm down inflammation. But remember, in the first few weeks, ice is best. Now, while you should only use ice intermittently, you can use compression constantly. Whether it's a compression stocking or elastic bandage, gentle pressure reduces swelling throughout the day. The compression from these garments gently squeezes fluid from the leg to the rest of the body. And less swelling means more range of motion. It just shouldn't be so tight that it causes pain, numbness, or tingling. The next strategy uses physics to do the work for you. That strategy is elevating the leg. When you're sitting or lying down, prop that leg up. Gravity works against you when your leg is down because it causes fluid to pool in the leg and the knee. But elevating your leg makes gravity work in your favor by draining fluid away from your leg and back into the rest of the body, reducing the tightness that limits your knee's motion. Elevate your knee above the level of your heart when possible. Even if you only do this for 30 minutes at a time, those sessions add up throughout the day. But here's the hard truth. Everything I just told you won't make a difference if you skip this last strategy. You must do your exercises diligently. Your physical therapist will give you specific exercises to do, like knee extension stretches and heel slides, and those exercises are what actually stretch the soft tissues and restore motion. I'll also post a separate video about exercises you can do at home, and I'll link it at the end of this video, but your personal physical therapist has the best individualized plan for you. The pain control, ice, compression, and elevation are all just supporting actors. The exercises are the star of the show. Do them as prescribed by your physical therapist every single day without fail. Remember that these strategies form a system that works together. Ice, compression, and elevation reduce the swelling and inflammation that limit motion. The exercises physically restore that motion, and pain control helps you stay consistent with them. Each strategy plays an important role, and dropping even just one of them means that you may not reach the motion that you're capable of. Now, I know you might be thinking, this does not sound pleasant. And you're right. Look, for most people, the first 6 weeks after knee replacement are hard. The swelling, stiffness, and pain that we talked about counteracting are exactly what make the recovery so challenging. But don't lose sight of why you had knee replacement in the first place. It's not for how you feel in the first few weeks after surgery, but for the months and years to come. You won't have to use these strategies forever. And if you put in the work early on, you set your knee up to serve you well for the rest of your life. Next, I'll post a video on specific exercises you can do to maximize your knee's range of motion. Once that's ready, I'll put it on this side of the screen. If you found this helpful, click the like button. It helps other people find this information when they need it most. Stay well, and I'll see you in the next video.